I think we see this a little bit with the blood pressure guidelines, where I think you had an editorial on this as well, where as a population, our blood pressure kind of has increased over time to where all of our blood pressure is a little bit higher than what it probably should be. And so treating it would not be unreasonable. And yet some of the backlash from the guidelines is that we're over medicalizing these people. We're taking healthy people and making them sick by having to give them medications. But at the same time, the epidemiologic data would support that their blood pressure isn't normal or isn't in a healthy range, and that lowering it would potentially be a benefit.
Yeah, exactly. And again, these are things that are a little bit hard to communicate to people. The difference between a treatable level, where, how do we decide about treatable levels? We learn that by trying to understand the risks and benefits of treatment. But the ideal levels would be, those would be really what you might call normal. And ideal levels are probably so low that it would shock most people, to think that, oh, what you're talking about is normal blood pressure might be less than 100 systolic, less than 60 or 70 diastolic. That might be what you'd call normal.
Right.
And I'm basing that on, these epidemiologic studies where, where does the risk actually get to the lowest level?